and my speech today is on rescue. Actually, it's on therapy pets, but rescue pets can be part of therapy pets. I'll get to that in a minute. Anyhow, rescue therapy pets are pets that are used in, for some type of therapeutic setting, either in a hospital or a nursing home or in a library to read, like my dog Jada here, who is a therapy pet, is doing with Nicole. And they can be used in a lot of different situations. The difference between a therapy pet and what sometimes people think of as therapy pets, would like seeing eye dogs and canines for a good cause and stuff like that, is those dogs are specifically bred, specific breeders. These dogs spend a year with people, families, being socialized, and they end up going back to those institutions and trained for those jobs and for the family or the person they're going to help. That's not what we're discussing here. Today what we're discussing is Therapy Dog International and Delta Society is what they call it. And what this is are basically pet owners. The dog can be a purebred, the dog can be a pound rescue. It doesn't matter. That the people themselves have taken, trained, put through the testing, and volunteer their time at nursing homes or hospitals or physical therapy settings or whatever, with their dog. So it's completely a volunteer thing. Now, with my experience with Jada here, she's my first therapy vet, is we basically went through basic obedience originally, was her original training, and then after she made it through her obedience training and her intermediate, she had to pass first the AKC Canine Good Citizenship exam. That is a standardized, well, for dogs, a standardized test through AKC. Once she passes that, then she's eligible to either take the Delta Society test and or the Therapy Pet International, which is what she has. And then that gives her her little ID card here, which makes her a therapy pet. And that allows her to go into hospitals or, those type of environments. And the difference between having this test with your dog and not is just that a lot of places feel more safe with these dogs. They've been tested. They actually have insurance behind them in case something happens than just a pet coming in off the street. They're put through different things to see how they're going to react. I mean, there isn't a 100% guarantee, but, hospitals and places like this just feel a little bit more comfortable with these kind of dogs. And actually, basically, what I'm here trying to promote is more people getting involved with their pets, because it can be any pet in the world that does this. I mean, as long as they're well-mannered and well-trained and will listen to their owners, it would be great for them to go into a rehab center and let that stroke patient try to use their hands they can't use. It's amazing to see people who'd rather pet a dog than to try to grab a little squeezy ball. There's like no motivation in this little squeezy ball. But, the minute you go in and they see the dog, all of a sudden they forget, oh, this doesn't work anymore. They just want to reach over and pet the dog. It's just kind of a human nature kind of thing. And then you got children with autism that just will not react very well with people at all, but yet they've done tests and studies and have shown that they will react and interact with the animals. There's some kind of level of communication there that just isn't there with people. And children they found in school that aren't doing as well, especially with reading, a lot of libraries have programs where they set the dog, you take your dog in, your dog goes and sits with the child, and the child reads a book to the dog. And for some reason, the child is more than willing to open up and read the book to the dog, but they're not quite as willing to open up and read the book to their instructor or, their parents. So that's another good benefit used for them. And like I said, it's completely 100% volunteer. It would be great if more people would get their dogs involved. It's very simple. It's just basic obedience, and then from there, the Canine Good Citizenship, and then getting them certified, and then just getting out there and doing it. The people volunteer their pets, they volunteer their time. It's a great mood lifter. Studies have shown that people who have pets live longer, lower blood pressure rates, lower triglyceride levels. There was actually one study out there that showed that heart patients after open heart surgery, those who had pets actually had lower cholesterol levels and lower blood pressure levels than those who didn't have pets. So, there's a lot of pluses here. They're mood lifters. It's a very inexpensive in today's day and age with medical costs soaring through the roof. This is something that's very positive, basically no side effects, other than, you know, I mean, if you have allergies, I guess that's a side effect. But basically safe therapy that can be used in these situations, inexpensive, and all it takes is somebody to volunteer their time, train their dog, which is a good idea anyway. I mean, do you really want your dog running through the house, tearing things up and being a complete terror? I mean, really do want a well-behaved dog, so it's a benefit to the owner, too, to train your pets. Take this test and then just get out there and, you know, share the love you have for your dog with other people that at the time just either can't have a pet or, you know, maybe they're missing their pet. They're in the hospital and they just can't have a pet in the hospital. So it's just a nice plus all the way around and something you can do with your pet that is worthwhile. So my suggestion, does anybody have any questions about this?
Who would you call? How do you get involved in this program?
Well, first you'd start out with, again, basic obedience, just finding a good basic obedience instructor, and most of your dog clubs around are somehow affiliated or they can hook you up with somebody to take the AKC, good citizenship test, and then move on to the TDI.
How long did the TDI take?
The actual test? About a half hour. About a half hour to get your dog through.
With the training part, how long was that?
The training part actually is just, she just went through basic and intermediate obedience,
Okay.
2 classes.
Okay.
It depends on you and it depends on your dog. If your dog's really motivated and wants to learn, it won't take you that long. And if they're a little bit more stubborn, it might take you a little bit longer.
It's such a sweet dog.
And I just want to pan around and show my audience. There's Steve. And there's Kim.
Hi.
And there's Nicole, who is holding Jada,
The star of the show.
who is also, well, actually, she's not over the age of 12, but that's okay.